This brings us to our next topic, and that's parasites. You know, the puppies get treated for parasites and worms. These things are inevitable. What happens is, if a puppy has parasites, they defecate, and if a puppy steps in that area where the puppy defecated that has parasites, they lick their paw, they're going to infect themselves with parasites. So even sometimes if a puppy was treated with parasites, they can reinfect themselves with parasites by stepping and walking in that area. Okay? When you have, your dog, your new dog, if you have another dog, and this is another reason why, it's best to train the puppy indoors on a wee wee pad. So when they defecate, you promptly pick up the fecal matter and the wee wee pad and you throw it out. Because if your existing dog ate it or stepped in it and then licked their paw, they're going to get infected with parasites. These things, they're relatively common. The important thing is that this is not life threatening. It's more gross than it is life threatening. For your first vet visit, they're going to ask for a stool sample. And if the puppy has parasites, the puppy's going to be treated at no extra cost. Signs that a puppy may have parasites, the two popular parasites are Coccidia and Giardia. You may see blood or mucus in the stool. This is not life threatening, but this is a situation that you'll let us know and let our vet know. Sometimes what happens is if you do some internet research, you think, oh my God, my puppy has parvo, it's life threatening. So that's why we want to let you know. We want to tell you beforehand that if you see this, don't worry. Don't, get freaked out. It could very well be this. Go to sleep. Let us know immediately. We'll get this rectified. Unfortunately, and this is also why we tell our customers to use our vet because they are incredible, they're honest and ethical, and not all vets are. We had a situation in which customers saw that there was, blood in their puppy's stool, in their fecal matter. And at like 1 o'clock in the morning, they brought the puppy to their vet, and it was like an animal hospital. And what ended up happening was that all puppies get live vaccinations. One of the live vaccinations that they get is for parvo. So they did a test for the puppy for parvo, and the test came out positive. But of course they'd come out positive. They had a live vaccination for parvo. So the vet tells the customer, I don't know, your dog may or may not make it. We're going to send you about a $4,000 bill, $3,000 to $4,000 bill. And then miraculously, the puppy makes it. Just because the puppy had a parasite. So that's why we tell you, use our vet. You'll be covered. Everything's okay. They are the best. But we want to inform you that if you see blood or mucus in the stool, don't worry. Just let us know. Let our vet know. And it will be rectified. Now, as I said briefly, you want to keep, if you have a dog right now and you're bringing a puppy into your home, ideally you want to keep the two dogs separately for 2 weeks. I know it's difficult, but it's ideal, strongly ideal. You want to be smart. You'd rather be proactive rather than reactive. If you do have a puppy, a dog, and then you bring a puppy into your home, earlier I said 10 minutes of playtime and followed by 2 hours of rest. If you have another animal in the home and they're playing, it's now changed to 5 minutes of playtime followed by 2 hours of rest. Reason being is that they run each other around much more. And we want to, as I said, keep the puppy not too active, keep the puppy resting, let their immune system be high, and not stress the puppy out. In regards to the parasites, as I said before, if either puppy defecates, you want to quickly clean it up to make sure, and some people will even use like a cleaning solution in that area to make sure they're not passing pathogens back and forth, especially with your puppy with the underdeveloped immune system. So the cleaning solution's a good route, but as I said, you really, really want to keep the puppy indoors, separated from your other animal, for 2 weeks. We pad training for 30 days, all right, and minimal activity, 10 minutes of play, followed by 2 hours of rest. With another dog, 5 minutes of play, followed by 2 hours of rest. And keeping your puppy, your new puppy, away from dog parks, away from taking long walks. You don't want to bring it around other puppies. And when you have a party, it's good to use crate training. We are big advocates of crate training. Crate is like their little home. That's their place of peace and solace. I have a man cave. My dogs have crates. That's their little puppy cave. And you have a party at your home. It's overwhelming for a puppy. A lot of times when they're under a lot of stress, they are not going to eat well. You could tell their behavior starts to change. So you want to use crate training as a way of positive reinforcement, never negative reinforcement, always positive reinforcement. What I tell, people like our customers to do is, even when you're home, watching a movie, allow the puppy to stay in a crate. They can hear you and they can hear that you're home. You're not just throwing them in a crate and then leaving, which is going to cause them to cry. Even when you're home, you put them in a crate. So they don't know if you're staying, if you're going. It helps to make the transition a lot easier. But crate should be their home. When there's too many people around, put the puppy in the crate. If you have another dog that's out and active and around, moving around, put the puppy in the crate to separate the two for those 2 weeks, and you'll be in a good place. All right? Next we wanted to, go over some things to look out for in regards to the puppy. Little signs that the puppy may be sick, signs that if you see them, you will contact us and contact our vet. Now, if a puppy's nose is wet and moist, that's fine. If a puppy's nose is dry, that's also fine. If a half of the puppy's nose is wet and the other half is dry, let us know. It means that there may be, a nasal leak, and it means that, a bug may be coming. All right? If the puppy wakes up and you see all this crust around the nose, same thing. Let us know. Let our vet know. If you see bubbles coming out of the nose, let us know. Let our vet know. If you hear the cough or the let us know once again. It's good to be proactive, rather than reactive. And that's why what we try to do is, the reason we do all this extra due diligence and give you this information is because we rather hear about things in its infancy stage rather than you have to wonder and guess, maybe, the puppy will get sick and it will get worse. So that's why I want to give you this information, not to scare you, but to keep you informed. Just like when you become a parent, it's nice to have people around you that can share their experience and things that they've learned, to be proactive, to be the best parent you can be. So if a puppy gets sick, the puppy shall be under no activity whatsoever until, we tell you otherwise. 0 activity. That means quiet room, keep the puppy in a crate, quiet, put some food and some water in the crate. We have to, sometimes take off, our emotional hat and put on, our business hat, because it's serious. The puppy has to be not active whatsoever. If you have people over and the puppy's in a crate and the puppy sees all these people, they're going to try to jump and they're going to cry and you're going to want to let the puppy out. So put them in a nice quiet room, let them rest, let them relax, let them eat so they can get better. Let the medications work, let their body heal, So it's very important. No toys, no distractions, just quiet in their little bed with food, with water. We want our customers to be prepared. So that's why we're giving you all this information. And that's why we also tell you to use our vet, because they are the best. We have people that come from Staten Island, New Jersey, Connecticut, and they don't come often, but the first month they come to our vet twice, and then as needed, they'll use our vet. But they're absolutely phenomenal, and they're going to get to optimal treatment. If the puppy gets sick, they're seeing the best. And as a parent, that's what you want for your kids. You want them to make sure they're okay. That's why we guarantee that these people are phenomenal. Um, so keep us informed. And these are things to look out for. So don't be scared, but we want to make sure that, you're well informed. Now we're going to talk to you about, hypoglycemia. So this is for the people that have a small dog, a teacup, a toy, a Yorkie, a Dachshund, something really small. If you notice that your small puppy is walking around looking like a little drunk, a little lethargic, you need to let us know. They need the appropriate nutritional intervention. And this is all stuff we're going to go over. But if you see that, let us know. Remember, 411 is better than 911. So we're going to go over it. Sometimes when a puppy gets transitioned into a new home, they may go, a day or two where they're not eating well or eating much, or sometimes not eating at all. Same thing with defecating and urinating. It's a stressful environment, going into a different home. So you're going to let us know. But just we wanted to let you know that sometimes it does happen. And we're going to go over, the food and supplementation program. Generally speaking, when the puppy eats, that should be accommodating to your schedule, whatever your schedule may be. So we're going to talk about, how to implement it when you come and pick up your puppy, how much, when, the puppy will be eating, how to utilize the supplementation program. But as I said, if you have a small dog, a teacup, a toy-sized dog, and you see your puppy walking around a little lethargic, just keep us informed. Sometimes the puppies, they'll throw up. Sometimes it'll be clear and they're throwing up like phlegm. You're going to let us know. Sometimes puppies eat their own fecal matter. Also let us know. These are things that are not abnormal, but it's something just to keep us aware of. The next thing you want to keep your eye out on is hydration. Now, you could check their gums and see if they're hydrating, obviously if they're urinating. Obviously they're hydrating if they're drinking on a regular basis. But a way to test hydration, the quickest way, is right above their spine, you're going to lift up like their skin. And when you lift it up and you pull it up, as I said, right behind the spine, you pick it up. If it drops quickly, they're hydrated. If it stays and slowly starts to come back, they may be dehydrated. Sometimes if puppies get, like nervous stomachs, as I said, a new environment, the puppies may have diarrhea. Let us know. Let the vet know. There are plenty of ways to rectify this, but if the puppy is experiencing diarrhea, they can get dehydrated. So let us know. There are plenty of ways to, rectify the situation. Make sure they stay hydrated, which is very important. So keep in mind, the dog's average body temperature is about 101 degrees to 102.5 degrees. So if you feel the dog and you say it's a little warm for you, the puppy may be sick, their average body temperature is warmer significantly than ours. So the puppy's, not sick, they don't have a fever. That just means that their body temperature is higher than ours. In regards to bathing, we suggest 2 weeks until the puppy is like put in a bath and bathed with, water. Always keep the ears from getting wet. If there's, moisture near the ears, they could get a yeast infection. So you want to make sure that, if you do and when you do bathe the puppy, to keep water away from the ears. After that does happen, you could also use, we suggest, for the first 2 weeks, baby wipes or some of the dry formulas for cleaning a puppy. That's fine. But as I said, keep those ears nice and dry. And then when you dry the puppy, make sure it's thorough. Whether you're using a towel or a hair dryer. If you are using a hair dryer, keep your hand there just to make sure that the air is not too hot and you're not burning the dog. But you want to make sure that the puppy is completely dry, top to bottom, in all areas. If they get out of the bath and they're shivering, remember, their average temperature is 101 to 102.5, which is warmer than, normally the air temperature. So they are cold. So you want to make sure they're completely dry.